discussing the tracheostomy care. So when we say tracheostomy care, it has something to do with the patient's tracheostomy. So tracheostomy is a small surgical opening in trachea or windpipe. It is also a tube or trach is placed into the hole for breathing treatments, and mucus can be removed by suctioning through this tube. And there are times that the ventilator can also be attached to this. Okay, so when we say tracheostomy, there is a hole on this area. Okay, so this is where the tracheostomy tube is being placed. And what is the purpose of having this tracheostomy tube? Of course, for breathing treatments. And another thing is considering that there is a tube that is being placed in this in your tracheostomy, of course we need to do the suctioning of the mucus. Then in some patients, if they have this tracheostomy tube inserted here, this is where the mechanical ventilator will be, the tubing of the mechanical ventilator will be attached. Okay. Then the tracheostomy care, it is done to keep your trach tube clean. So it helps prevent a clogged tube and decreases risk for infection and maintain patency of the airway. It also includes suctioning and cleaning parts of the tube and skin as well. So when we say tracheostomy care, we're not only dealing with the cleaning of the tracheostomy tube, but then we will also cleaning the surrounding areas of the trach. Even the thigh is also included in the tracheostomy care. So what are the materials in the tracheostomy care? Of course, we have the two small plastic containers. So what will be the purpose of this plastic container? Of course, the two plastic container. One is for rinsing, and the other one is where you will put the mixture of the hydrogen peroxide and of course the saline solution. So the dirty cannula will be soaked in that mixture. And the clean inner cannula is another material. So in some patients, for those who cannot afford the inner cannula, we can only clean what is being placed by the doctor, the inner cannula instead. So while they're removing the old cannula, you will just place the oxygen while you're cleaning the old cannula. But then if there are patients that can buy the new cannula, so you can just replace the old one with the new one, and the old one should be clean. Okay, so we have also the cotton tip applicators. So cotton tip applicators, that one will be used in cleaning the trach tube. Okay, the outside and even the skin on this one. So you can use that cotton tip applicator. Then we also have the hydrogen peroxide, the baby nipple brush or the pipe cleaner, because considering that this one is a tube, so parang tubo lang yan. So you need to brush not only the outside part of the cannula but also the inside of the tubing. Then we also have the small towel. So aside from the gauze, we can also use this small towel in cleaning the neck part where the tracheostomy tube is being placed. And of course, we have the gauze pad and of course the drain sponge. So gauze pad, we will be cutting a new one in replacement of the old gauze that is being placed in the tracheostomy. Then the trach tie. So there are some hospitals that they're using the Velcro, but in some public hospitals they still use the gauze tie. Okay, so another material for the tracheostomy care is of course the sterile gloves. Because why is it that sterile gloves? Because knowing that this one is already a dirty case, we still need to use the sterile gloves for us not to transmit other infections or other bacteria to the patient while we're doing or performing the tracheostomy care. And of course, we have the sterile water or the normal saline. So what would be the procedure in tracheostomy care? Of course, we need to gather the supplies. Then we need to wash hands. So before and after doing the procedure, we need to wash our hands. And before and after going to the patient's room, we also need to do the hand washing. Then put on the sterile gloves. Make a cleaning solution. Mix the hydrogen peroxide and saline solution in one container. So of course, you need to also provide a separate container for saline for rinsing. Then, change the inner cannula. Sabi dito, place 2 fingers of one hand to support the neck plate. So, if you will see the neck plate here, and there is a hole in here. So, this one is the neck plate. Okay? So, you will need to hold this one while cleaning. Okay? So, sabi dito, place the 2 fingers on one hand to support the neck plate while the other one unlock. So, you will unlock the tubing into counterclockwise, then gently pull it out. Okay? So, kapag pinul nyo yung tubing, trach tube, nakasupport yung kadaliri nyo doon sa trach plate. Then, insert the clean inner cannula. So, kanina, tinanggal natin yung old cannula. Then, ilalagay na natin doon sa solution ng hydrogen peroxide and of course the saline solution. And that's the time that you will insert now the clean inner cannula, the new one. So again, place the 2 fingers on the neck plate, then insert the new cannula. So before we place that one into counterclockwise, so this time we will be placing the tubing into clockwise position to lock in place the cannula. Then clean the trach area. Soak cotton tip applicators for 10 seconds in hydrogen mixture. Okay? So, yung tip applicator should be soaked in the hydrogen peroxide solution. And after that, you will clean around the trach using the sweeping motion in one direction, then discard. So, same with the perineal douching, that when you're cleaning, after using the cotton balls, you will discard it. Then another one again, then discard it also. Okay? So, you will be just using one applicator per area. So, one applicator per sweep, then discard. Then clean the neck plate with one or more applicators. Then, soak a gauze pad in the solution and clean around the neck parts. You may also use towel with soap to clean the area. So, yun yung purpose ng ating small towel. So, pwede nyo siyang sabunan para kahit paano nalilinisan yung neck part surrounding the trach area. Then, rinse well and dry with gauze pad. Then, inspect the neck and throat area for redness or sores. Then, report to the doctor if with skin problem. So, in every procedure, syempre kung ilang araw yan nakastay sa hospital ninyo at kayong gumagawa ng care na yan, so you need to observe. So, ano bang nangyayari doon sa wound? Is there any sutures? Nagkakaroon na ba ng abscess sa area? Lumuluwag na ba yung tubing na nakadikit doon na nakalagay doon sa tracheostomy ng pasyente? So, dapat yun kahit paano nanonotice ninyo so that you will report that one to the doctor if there would be any problems. Then, change the drain sponge as often as it becomes wet to avoid skin problems. So, yung drain sponge na yun, yung naka-insert. Ito yung trach niya, diba? So, may naka-insert dyan na gauze. Okay? So, yung gauze na yun, so dapat yun laging nakita kung soaked na. If it's soaked, you need to change that one. Then, change the trach ties at least once a week or once wet. When changing, place the new tie first, then remove the old tie one side at a time. When both sides are secure, place 2 fingertips between the neck and tie to make sure it is not too tight and needs to be snug but not too tight. So, ano ibig sabihin nun? So, meron ditong tie na nakadikit dyan. So, kung tatanggal niyo yung old tie na yan, dapat, wag munang tanggalin yan. Ilagay niyo muna yung new tie na ipapalit ninyo and that's the time na tatanggalin niyo yung old. At least, secure na siya. And, check nyo rin kung masikip ba siya or hindi. So, ang sabi dito, place 2 fingers between the neck. So, dapat ganito. Ito, kunyari, ito yung tie. So, dapat, ano niya, may space na ganyan, na kahit pa paano, hindi masyadong mahigpit yung pagkakalagay ng tie doon sa tracheostomy tube. Then clean the dirty inner cannula. So how are we going to clean the inner cannula? So soak, as you can see from the picture, soak the dirty cannula into the solution for a few minutes. Then clean inside and outside of the cannula with a small brush. So as you can see the tubing. So hindi lang yung loob ang lilinisin nyo. Pati yung sa labas, kailangan you need to also brush it. Okay, then rinse the cannula by putting it again into the saline to the other container. So ito yung mixture ng hydrogen peroxide solution wherein you will soak it first. And after it's soaking fresh, you will do the brushing. And after the brushing, that's the time that you will place it to the another container for rinsing. Then shake excess saline, place it on a clean towel or gauze, and allow it to air dry. Then, store clean inner cannula in a container. So, the moment na nalinis nyo na yan, and you have already placed the new cannula to the patient, that's the time that once na dry na yung nalinis nyo, you can keep that one in a separate container. Then, throw out your supplies and clean containers with warm soapy water. Then, rinse and allow them to air dry. Then, remove gloves and wash hands. Then, place the patient in a comfortable position. So, what comfortable position that we're referring it, or what that we're referring to, of course, it is the Fowler's position. And do your documentation. Okay? So, that's it. So, what are the important points? Your doctor will change the entire trach tube when necessary. So, as we've discussed a while ago, if there would be any problems with the tracheostomy, we need to report that one immediately to the doctor. So, trach care can make the patient cough. If this happens, cover the trach with gauze and wait until coughing stops. Okay, so normal naman yan na kahit pa paano, uubo yung pasyente kapag nag-change ka ng trach. So, yun lang, kapag naubo siya, pahantay muna natin huminto at i-cover lang muna and saka tayo mag-proceed to another procedure. Then, always check the skin around the trach area at least once a day. So, yun nga, kailangan na-check pa rin siya. Kung any abscess or any redness, that should be reported immediately to the doctor. So, sabi dito, call the doctor immediately if you are having problems with trach, especially if having trouble breathing. Then, if trach tube comes out, do not panic. Gently try to place it back in the hole. Okay? So, sabi dito, wag magpanik. Kasi the more kasi na nagpapanik ka, lalo nagkakaroon tayo ng error. So, if with resistance, so try nyo muna, ibalik nyo ko yung tubing. Kung medyo umaangat na siya, continue, ibalik muna yung tubing. And if with resistance, stop, then cover it with gauze. Then, ask your colleague to help you to report it immediately to the resident doctor. So, specifically, the surgical resident on duty. So, moving on with the next topic, which is the cold flow management. Bakit kinontinue ko na agad sa cold flow management? Kasi last week, we've discussed the suctioning. So, after the suctioning, of course, considering that we're doing the deep suctioning, and part of the deep suction is the tracheostomy, I might also include the topic of the tracheostomy care. And another topic is, of course, the cold flow management, wherein this one is must be also be included in the medical surgical management. So, when we say cold flow management, so we mean of this one is a message announced over hospital's address system, indicating that a cardiac arrest or respiratory arrest requiring CPR is in progress, and to be coded is to undergo CPR. So, as you can see from the picture, the man in black here is the one performing the CPR. So, what is the difference between the rapid response team and, of course, the code blue? So, dun tayo nako-confused eh. So, when we say rapid response team, the patient is still responsive, but there is a sudden desaturation on patient's status. There is also respiratory distress, and the oxygen saturation and even the normal vital signs is gradually dropping or below normal. So, what about the code blue naman? So, when we say code blue, the patient is unresponsive and there's no respiration or no pulse at all. So, kung makikita nyo ang difference, itong RRT, mayroon pa siyang natitirang vital signs. So, kaya nga tinawag na RRT, Rapid Response Team, yung immediate action natin para ma-revive yung pasyente, ando doon. Okay? Pero pagdating naman dito sa code blue, since dumating na siya na there's no vital signs at all, so what we're just doing is we will try to revive the patient. Kaya lang, most of the time, kapag medyo matagal na talaga na pulseless and no breathing na talaga yung pasyente, there's a tendency talaga na mag-e-expire at mag-e-expire yung pasyente. Unlike dun sa RRT, na kahit papano, kahit nagde-desat yan, bumababa, kaya pa rin habulin. Okay? So, yun yung difference ng RRT at saka ng code blue. So, what about the cardiopulmonary arrest? So, this one has something to do with also with a code blue. So, this one is a sudden loss of cardiac function when heart abruptly stops beating unless resuscitative efforts began immediately. So, the cardiac leads to death within a few minutes. So, what about the code blue team? So, when we say code blue team, it has something to do with teamwork. So, sino-sino ba yung kasama natin sa teamwork? So, of course, we have the team leader. So, most of the time, ang team leader natin is the ER consultant or the specialist. Okay? So, siya yung magmamando kung ano bang dapat gawin ng bawat isa. And of course, we have the airway, which is the resident on duty. So when we say airway, he's the one responsible for the intubation. And we have also the specialist, the anesthesia resident, the replacement of the ROD. So when we say this one, so in the absence lang naman ng ROD, saka lang papasok si anesthesia resident. And another theme, of course, is the compressor 1 and 2. Who will be the one to perform the CPR. So, yun yung tinatawag nating mga orderlies. Okay? Then, the communicator will be our nurse supervisor. And the vascular access is the nurse who will also initiate the IV insertion, the NGT, etc. So, when we say vascular access, initiation of the IV line. So, kapag nag-start na agad yung code, halimbawa, nagsi-CPR na siya, dapat kasabay na agad na nag-insert ng IV line yung nurse na isa. Okay? Then, the event manager or the charge nurse, most of the time, nandun siya sa station, and every single datas na ginawa dun sa patient, siya ang magdo-document ng lahat ng yun. And of course, the recorder as well, the bedside nurse. So, magkatuwang ang event manager and of course, the recorder. And the runner would be the nursing aid. So, kung ano yung iuutos, pakisuyo, pakikuha yung ganito, so siya yung gagawa, yung ating runner, the nursing aid. Then, airway assistance, which is the respiratory therapist. So, pagdating sa ganyan, dapat talaga, kapag may nag-aambubag ng mga nurses or doctors, dapat nakaabang na talaga yung respiratory therapist for us to for them to sub. Ibig sabihin, i-replace. Kasi nga, nakakapagod naman talaga mag-ambubag and of course, mag-CPR. So, in that way, actually, up to ambubaging lang dapat makakatulong kahit papano ang mga respiratory therapists. So, with those personnels, dapat yung teamwork hindi nawawala. Kasi kapag wala na yung teamwork, magiging aligagaan lahat and mako-compromise syempre yung ating mga patient. So, what would be the procedure in a code blue? Of course, you need to notify the entire hospital of the emergency situation by calling the info admitting to announce the code blue. So, for example, if you will be the one, if you're the nurse in charge at nag-room rounds ka, nakita mo yung pasyente, wala nang buhay, pulseless, and of course, no breathing na rin. So, syempre, you will initiate immediately the CPR. So, before that, while doing that, you will shout outside the station na, ma'am, pa-page na lang po ng code blue. So, yung nasa station, yun yung magpa-page ng code blue. Habang ikaw naman yung nagpa-perform ng CPR. Then, she will also notify the supervisor or the RIC. Then, repeat the code blue message after approximately 2 minutes unless it has been cancelled. So, there are times kasi na medyo matagal ang arrival ng mga doctors kasi nga hindi agad na yung page or siguro hindi nila naririnig. So, in that case, the nurse who asked for the information with regards to code blue, yung pagpe-page, i-repeat niya yun para ma-repeat yung pagpe-page ng code blue dun sa area ninyo. Then, all MDs and RNs go immediately to the identified area. Then the pulmonary respiratory tech also must be there, sabi nga kanina. Then the first person on the scene assists the staff member who discovered the patient with CPR and of course the life-saving measures. So sabi ko nga, nag-CPR na siya. So the moment na may pumasok na team, isasab niya yung isa para hindi mapagod. Then the the second person on the scene assists as needed and assumes the coordinator role. Then, additional responders are assigned roles as needed, like the runner, the telephone coordinator, and of course, the traffic control. So, runner, yung nursing aides, and telephone coordinator, sometimes it's the supervisor and even the traffic control. Now, considering that we're dealing with the code blue, of course, that includes, of course, the intubation. Kaya nga code blue eh. Okay, we're trying to revive the patient. And who will be the one to intubate? Of course, the resident doctor or the consultant. Or might as well the anesthesiologist or resident. Okay, so when we say intubation, it is the insertion of a tube into the windpipe so that oxygen can be supplied to the lungs, and usually during surgery under the anesthesia. So if the patient is still awake, sabihin na natin yung pulse niya mahina pa rin, ganyan. But still, may pulse pa rin siya. Pero kahit pa paano, nanlalaban pa rin. That's the time that we can give the anesthesia. Pero kung sakali naman talagang walang-wala na, there's no need for you to give the anesthesia. So what are the materials needed for intubation? Of course, we have the laryngoscope. So, laryngoscope handle and blade. Then, clean gloves. Sterile gloves. So, yung clean gloves po, yan po yung ginagamit ng kapag nagsasuction, and the sterile gloves will be given to the doctor who will intubate the patient. Okay, so the sterile gloves. Then of course the 80 tube, the endotracheal tube, size as ordered, and of course the stylet, and the 10cc syringe. So yung 10cc syringe natin, yun yung ginagamit natin pang-lock doon sa 80 tube the moment na nailagay na yung 80 sa pasyente. Then, the leucoplast. So, let me remind you, ang ginagamit natin during intubation is not micropore, it's the leucoplast. Then we also have the defibrillator and of course the cardiac monitor. And of course the suction machine, suction tip, the irrigation solution, the ambu bag, and of course the oxygen. So what is the procedure? So check for the cardiac rate and of course the heart rate, then do the ambu bagging and of course the chest compression, then connect to cardiac monitor and of course the pulse oximeter. So as you can see from the picture on the right side, so yan yung tinatawag nating laryngoscope. So yung makikita nyo parang nakakalawit na yan. So tatandaan nyo as nurses, let me remind you na dapat kapag mag-intubate si doctor, make sure part of your checking sa inventory na dapat na-check nyo ang laryngoblade, yung lalo na yung bulb, kung busted na ba o hindi. Kung busted na siya, dapat na-replace na yung bulb niyan. And another thing is, since hindi naman kayo naglilinis ng laryngoscope at ang mga orderlies natin or nursing aid, i-check nyo, baka kasi yung battery na nasa loob, nababad na rin sa tubig. Okay? And what else? Hindi naman sa tinatakot kayo. Kapag nag-intubate kasi, hindi mo kasi masasabi kung anytime, pwedeng mag-toxic yung pasyente ninyo. So, dapat, as a nurse, it is your responsibility to check yung bulb mismo ng laryngoscope nyo kung nagfa-function pa. Kasi kapag nag-busted na yan at binigay mo sa doctor during intubation, pwede nyo ibato sa'yo yan eh. Kasi nga, mag-i-intubate ako, bibigyan mo ko ng palyado. So, dapat doon pa lang, bago pa niya magamit yan, na-check nyo na nurse. Okay? So, yan ang isa sa mga trabaho natin mga nurses. Lahat ng mga posibleng gamitin natin sa pasyente, dapat na-check natin prior you gave it to the physician who will do the procedure. Then, what else? Start venoclysis. Usually, most of the time, we're using the plain normal saline as fast trip. Okay? Then, give dormicum or diazepam as ordered if the patient is agitated. And let me tell you, you're not about to give the medicine to the patient unless it's been ordered by the physician. Can give epinephrine every 3 minutes as ordered. So please be mindful of this one. The interval is 3 minutes. And the senior ROD or the consultant will insert the 80 tube with the use of the laryngoscope and of course the stylet. And As nurses, ang trabaho po natin ay mag-assist lang sa doktor. So, if in case that the doctor had already intubated the patient, you will be the one to give him the stethoscope to check for the bilateral sounds, okay, of the chest, of the lungs. Then, once in, inflate the balloon with the 10cc syringe. Yun yung purpose ng 10cc syringe. Kasi merong balloon yun, once na inflate nyo na, hindi dapat yung nakalawet. Dapat nakakoil lang maayos at nalalagyan ng micropore. So, secure the ET with leukoplast, 3 slits or 2 slits, then tape also the balloon with micropore. So, depende sa practice ng isang doktor kung ano bang gagamitin niya. It is the 3 slits or the 2 slits. Okay? So, yung paggamit lang naman yun, kung ano bang nakatubo ng pasyente, nakaganyan yung leukoplast. This one is the upper and this is the lower. That one is for the halimbawa 2 slits. So, ito, minsan, ang ginagawa nila, ito, nakadikit dito, pag 2 slit, ito naman yung nakakoil sa tubo. Pag naman 3 slits, parehas na nandito, meron sa upper, meron din sa lower, then yung pangatlo, yun yung kinukoil sa ET tube. Then, attach the ambo bag and do continuous bagging. Combo bagging. So, kapag naka-ET tube na siya, that's the time na i-connect nyo na yung mechanical ventilator. Then, connect the patient to mechanical ventilator afterwards. So, NOD must document every details that took place at the time of arrest, including epi every 3 minutes. Okay? Again, ang interval po ng pagbibigay natin ng epinephrine is every 3 minutes. And the time started, the med started, the IV started, even the intubation started, as well as the materials used on arrest will also be documented. And another thing is, please be mindful of everything that you used with the patient. Lahat po yun naka-charge. So, isa yun sa mga trabaho rin natin as nurses. So, another thing is, ang sabi dito, when it comes to documentation, dapat time-bounded tayo. Kung anong oras ka nagbigay ng gamot, anong oras na intubate yung pasyente, ano pa mga procedures na nagawa ninyo, ano pa yung mga additional orders na in-order ng doktor, dapat lahat ng yon may time. So, and ano ang dapat na gagamitin yung orasan? Hindi po yung sarili yung orasan, kundi yung orasan mismo dun sa area kung saan kayo naka-duty. So, kung may wall clock dyan sa area ninyo, make sure na updated or nasa tamang oras lagi yung nasa wall clock ninyo, yung nasa wall ninyo. Kasi yan yung pinakabasehan ninyo nung time na ilalagay ninyo on your documentation. Okay? Kapag po nagko-code. Okay, so that's it. And reminders, have available one size larger and one size smaller when it comes to ET tube. So, ET tube sizes for child. For ET 3 to 3.5 is for the newborn and infant. Then, ET 4 and up for 1-year-old. And for adult naman, sa adult female, we're using the 7 to 8 ET tube. And for adult male, we're using 8 to 8.5. And the straight blade preferred for children and infants for laryngoscope. And for adult naman, we're using the curved laryngoscope kanina, just like what I've shown you before in the picture. The laryngoscope blade is for the adult patient. And emergency rule when it comes to ET tube, the 7.5 fits most adults. Okay? So, emergency drugs, these are the drugs used during the code. Of course, we have the epinephrine. So, ito lang namang mga drugs na to. Gusto ko lang kayong ma-familiarize with regards to this kapag nagko-code blue. So, ano ba yung mga emergency drugs na yun? Of course, we have the epinephrine, which can treat, of course, the cardiac arrest, the ventricular fibrillation, pulseless, the VTAC, asystole, and the PAA, even the symptomatic bradycardia after atro, tupa, and transcutaneous pacing. And it can also be used for severe hypertension and anaphylaxis for severe allergic reactions. So, most of the time, we're giving the epinephrine 1 milligram every 3 to 5 minutes during resuscitation. What else? Another med, of course, is the atropine. So, this one can treat for asymptomatic sinus bradycardia, presence of AV block, or ventricular asystole. Then, pulseless electrical activity and bradycardia, of course. And sometimes, if you're having problems with injecting meds through IV, kasi there are some cases like may mga patient na mahirap talaga insert ng line, especially the cancer patient. So in that case, if the patient has been intubated, you can also give meds through the ET tube by diluting that one into 10 ml saline. Okay? Then another kinds of meds that we're using during COVID is of course the lidocaine, which is given for acute treatment for ventricular arrhythmias. Then of course the pulseless VTAC when amiodarone is not available. Another one is of course the amiodarone. It is a wide treatment for wide variety of atrial and ventricular tachyarrhythmias. And of course rate control of rapid atrial arrhythmias in patients with impaired left ventricular function when digoxin is ineffective. And usually, binibigay natin siya kapag nagka-cardiac arrest ang pasyente through IV push. Dinidulot natin ang 300 mg in 20 to 30 ml of defined water. Okay? So, ayan namang mga ganyan. Itong mga meds na to, mga cold meds natin, itong mga inotropes na to, may mga certain orders naman ng mga doctors na ipa-follow nyo lang. And of course, we have the dopamine. This one is the second drug for symptomatic bradycardia. Then it also, actually ang dopamine, pinaka-use talaga nito is to treat hypotension. Okay? With signs and symptoms of shock and cardiac arrest also. But that one, most of the time, if it's not that severe na yung pagkababa ng BP niya, nag-start pa lang tayo ng silgal concentration. And if in case na medyo bumababa, itatitrate lang natin. Pag medyo naman pag medyo pala bumababa, itatitrate natin up. Pag naman tumataas, itatitrate down natin. So for monitoring muna, then we will refer that one to the doctor, and that's the time that you will titrate. Yun yung ibig sabihin ng titration. It's either ibababa mo ba yung regulation or itataas mo yung regulation. Okay? Then another one is the vasopressin, alternative pressor to epinephrine in treatment of adult shock refractory ventricular fibrillation. This one may be useful for hemodynamic support in septic shock. So this one is being given 40 units IV push. Okay? Once lang naman siya binibigay. Then of course we have the dextrose. The reverse severe hypoglycemia symptomatically may manifest as nausea, hunger, headache, irritability, lethargy, and of course ataxia or mental confusion. So usual dose na binibigay natin is 10 to 50 ml of dextrose, D50%. Okay? And another thing is the adenosine. It is the first choice of drug for narrow complex, the PSVT, terminating of repeated arrhythmia. So initial bolus nito is 6 mg IV push. Okay? Then procainamide hydrochloride. So this one is for uncontrolled PSVT as long as with stable BP. So this one is given via IV infusion. And another one is of course the sodium bicarbonate. If prolonged resuscitation with effective ventilation or upon return of spontaneous circulation after long arrest interval. So this one, kapag nagbibigay tayo ng sodium bicarb, kailangan meron tayong ABG analysis na ipapakita sa doktor so that the doctor will know if the patient is acidotic or not. Okay? So dun siya magbibigay. It depends upon the source of this ABG. Okay? And for the crash cart, we have the cardiac monitor, the defibrillator. Those two equipments actually, in some special areas, we have that one already mounted on the wall. Kaya lang pagdating sa ward na, wala na siya nakakabit. So that's the time that we can use the cardiac monitor and defibrillator, which is on top of the crash cart. And another thing that the crash cart had is of course the emergency meds, which is being placed on the upper layer or the first layer of the e-cart. And of course, we have the laryngoscope, the ambo bag, and the miscellaneous medical supplies. So when we say medical supplies, the miscellaneous, it includes of course yung mga tubings na ginagamit natin sa pasyente, the NGT tube, the Folica tube, the IV tubings, and the likes. Okay? And of course, we have the cardiac board. So, where can we see the cardiac board? It's behind the crash cart. So, as you can see, if there would be any code blue incidents in the hospital, agad na dinadala ang crash cart kasi ang crash cart na yan, lahat ng nandiyan dyan is para sa emergency use ng pasyente. Okay? Then, what else? So, kailangan kapag every shift dapat monitor nyo yung laman ng crash cart ninyo. Natitingnan nyo kung merong bawas, dapat nare-replace siya. Okay? For the succeeding use. And remember, always check the crash cart for this emergency drugs. So, not only for the quantity, but also for the expiration. If the tubing, hindi ka po pwede basta-basta maglagay ng NGT tube or ng Folica tube na expired na. So, dapat yun na aalis na papalitan. Before the start of your shift. So, shifting po ang pag-i-inventory. So, trabaho din natin yung mga nurses. Then, for documentation naman, as a code team leader, ano bang mga sinusulat ng code team leader natin? Of course, he was the one responsible for the written orders, the code notes, and of course, the transfer referral. If the patient should be needed to be transferred to the other hospital, siyang gumagawa ng order na yun. And as a charge nurse, ang trabaho ng charge nurse when it comes to documentation is the pertinent data pertaining to event. Dapat na-document yun. The administered medications, even the chart completion, and of course, the charting. Trabaho yun ng charge nurse. Then, let me just leave this with you. So, by failing to prepare, you are preparing to fail in your role of saving lives. So, tandaan ninyo sa ating mga nurses, nakasalalay ang lahat na. Ang buhay ng pasyente nakasalalay sa inyo. So, kung hindi kayo prepared, so paano nyo i-revive yung pasyente? Okay? Kung kulang-kulang ang mga gamit na supposed to be dapat na nandiyan dyan para i-save natin ang pasyente. As nurses, we need to be prepared at all times. So, thank you very much for your time. And for you to be understand well with regards to our topic for today, I will be posting the sample video of those topics that I discussed, which is the tracheostomy care, the good loop process, so that you will better understand of the topics that I've been discussing this afternoon. So, thank you very much and hope to see you by after the midterm examination. So, thank you and good luck.